Hit.
All right.
Do it to it.
So a co-host that is near and dear to ComHit's heart is the Florida Agency for Healthcare Administration. And part of the reason is that their mission is better healthcare for all Floridians. And the other part is the incredible people who work there. And Jamie Harley is one of those special people. She's the outreach coordinator for the Florida Health Information Exchange at AHCA, and that's a role she's had since 2024. She focuses on creating educational opportunities, developing materials on HIE programs, and collaborating with community partners and healthcare providers to highlight the impact of health IT.
That sounded really fancy.
And she has over 18 years of experience connecting with individuals through her sales career. She brings a wealth of knowledge, a collaborative approach, and a sunny disposition for everything she does. So with that, I welcome Jamie Harley.
Thank you. Thank you all. I tried, look, I tried to outglass her. I tried to outdo my glasses, but I don't think it worked. So anyway, today, welcome. My name is Jamie. I am from AHCA. I've been here for a year and some change. I was an interior designer by trade. 18 years, interior designer. That's what I was doing for the rest of my life, right? Then I got cancer. And then I said, wait, what? What am I doing? What am I actually doing with my life? Am I really going to design offices? Because I was a commercial designer, so I made good money. Is this really what I'm going to do for my life? And I said, nope. I took a pay cut and a half and more than a half, and said, I'm going to enter somewhere where I can do something. I knew nothing, at that point, I knew nothing about healthcare. What I said was, okay, well, where can I be effective? And it is outreach. It is coming to talk to you. I can tell you about everything AHCA is doing. I can explain it. I may not know it, but I can get you to the people that do know it. And that is what I have found is people call me and say, I can't get through, I can't get answers. I can get them for you. So today, I don't have much time. Thank goodness she only gave me 15 minutes. Thank you, Kendra. Kendra is near and dear to my heart because she has taught me about health IT, period. She is the person, her and my boss are the two people in this planet that have really sat down and explained to me what everything means. So thank you. But what I want to say is 99.9% of your effort good enough? Is it? Is it really? Really, when we think we get 50%, 75%, when we're tired, is that enough? Well, I looked up a few facts. Because Kendra was my first superhero of the month, and now she puts me on the stage after I did it to her, so, well, I guess. Do you know that if 99.9% effort, 1,000 pacemaker operations would be performed incorrectly? If only 99.9% effort was enough, not 50, am I reading that right? It's got to name my glasses. 50 million incorrect drug prescriptions will be written incorrectly this year. Those are just things that we really need to think about when we're talking about patient whole health, right? I have my cancer experience. I have, especially talking about EMS workers, ENT workers, like all you guys. How many times my mother-in-law has gotten an ambulance and for a urinary tract infection that was going to her brain, and how special the work that you're doing. It's so important, and I just thank everybody in this room for what you do. So on to that, really, what is ENS? What do we do? Yes, we do policy. Yes, we come into hospitals. Yes, we do all of those things. But really, if you could just go to slide 4 for me, and it's what is ENS? The Encounter Notification System. This is what you guys need. You need to know the ADT data. That's what's important. it helps everybody. It helps the providers. It helps, you guys know, okay, you went to Grandma's house 4 times this last month. Okay, I know what I'm dealing with now. I know how to handle it. It shortens the level. I don't necessarily need to take her to the ED this time. Okay, fine. Let's prevent the hospital readmissions, right? And then if you go on to the next slide, slide 5, this is how ENS works. This is my favorite slide. This is actually how I learned the system. Okay, you have data sources, right? You have all the sources. It's free. It's free by the state. You send it in. You have to send it in. You're kind of required. It's kind of a law. And you send it in, but then you have subscribers that send it back. And it's at a low cost, as low as $500 for 500 beds or 1,000 beds. Email me. It is so super cheap to get all this information, and it's just a wheel that turns and can save lives. Absolutely save readmissions, cut costs. I mean, we're not here. We are, I like to say what we are, because I am from the furniture business and not from the health world, so you have to describe it to me like a real person. What are we? We're an absolute spider web, right? And I'm right in the center of it as your patient. I'm right in the middle. And all the webs that go outside, those are your providers, your subscribers. Like, I don't care if I'm sick, I'm sick. I don't care if you're a subscriber, provider, data source. But you're my oncologist, you're my radiologist, you're my primary care. I have neuropathy in my feet from that. Sorry for the poor lack of shoes, that's why. But all the things, and now they're all connected. And what I'm running into all the time, especially when I had cancer, I had to carry around a stick and say, oh, here's my data. Here's everything that I need. Here's what I have. Here's my heart condition that I have on top of that. How about my dad? My son plays college baseball. We were in, where were we? North Carolina, Washington, I don't know, somewhere up there. And my dad goes, oh, my heart feels funny. My heart feels funny. Okay, so in the middle of the night, we take him to the hospital, and he's in, you guys know better than me, AFib? Okay, that thing. He had to have surgery right then. And they said he would die, that he was not going to make it back to Florida. And they immediately, oh yeah, your hospital, TMH, yep, we have all your records. It took a matter of like 4 hours, and he was already in surgery, everything great. And I'm like, wait, what? You can do that? And they're like, yeah, of course we can do that. Okay, all right, amazing. So that's why all these health information exchanges are so important. Kendra's work is so important. And now we're talking about going to space? Are you kidding me? Like, this is crazy. Like, how are we going to project the HIE into space? And of course we want to do that. That's exciting, super exciting. But I love our network. We're having other states come to us and asking us how that they can model after the state of Florida. I think that's amazing. I'm just out to talk about it. My boss is really the cool one. Most of you know Pam King. She is like, love her. But anyway, that just to say that is what we do at AHCA, and we're not here. Yes, we're regulatory to check on everything, but we're here to help. If you have questions, call me, email me. I probably won't know the answer, but I guarantee you that you'll have an answer. I've told a few of you here today that I will get you the answers that you need. I promise. I have that sales mentality in me. It's called the 24-hour rule, right? You have to get somebody an answer within 24 hours or you fail. I live by that. So everything about the HIE is near and dear to my heart because we are just the spider web of technology. And if we can connect to the national levels and the different state levels and the different places, behavioral health is becoming such a huge thing, as we all learned with the Florida State thing that happened this week, that I will not get back into, so I won't cry. Behavioral health has got to be part of our scene, has got to be part of our interaction, and more. Like, we just need everything. And we're so passionate. People think, oh, you're just AHCA, you're a state agency, meh. You don't do that. We care. Every one of us care, and we care about what you do. And if you can tell me how we can do it better, I will take it back. Can I implement it? No, of course not. I'm just Jamie. But I can definitely take it back, and I can make sure that your voices are heard. So if you have something that needs to go back to AHCA, please tell me. I brought a pen and a piece of paper to write down anything, because that's really all I wanted you to see is this, how ENS works, like the cycle, the wheel, how it goes back and forth, how we send data, how we receive data. And that's really it, is to take questions from you, for me to take back to my leadership to help you. So I know I am only 10 minutes in, and I was nervous as crud to come up here and talk, and Kendra knows that. But I want to take your questions. Do you have questions for me to take back to leadership for you?
So does this already exist?
Yes.
Through AHCA?
Through AHCA.
So,
How do you access it?
yeah.
How do you become a partner? How do you, if this program already exists through health integrated entities, how do other health agencies get connected to be part of the scope?
Give me your business card, and we'll set up a webinar. We'll set up a webinar with our vendor and get you set up you can get set up within a week.
All right.
Absolutely. And on top of that, I have a superhero of the month, FYI. I do 2 webinars a month. Kendra was my first superhero, because she is the superhero of the year. So she was my first. And so you can come on, you can watch the webinars that I do. They're all on our website. I have a business card. I'm at the booth in the back corner. But give me your business card. We can get you set up.
Thank you.
Jamie, do you want to talk a moment about Plus E and how that's used in public health emergencies?
Yes. Okay, so the second half, ENS is our big boy, right? That's our big guy. But E Plus is in time of active emergencies. When the governor calls an emergency, we have a program called E Plus. And what it does, it's disaster. In a disaster, we set up different shelters. In Leon County, where I live, where my son goes to school, Lincoln High School is our emergency shelter. And my son, TJ, gets all excited because he doesn't have to go to school. But if you have an emergency and you're on dialysis, but you don't have any electricity, what are you going to do? What are you going to do? So we activate that system, and then we monitor, and we can find out. That's the only time we can look up Social Security numbers. Other than that, AHCA does not look up Social Security numbers, only the last 4 digits, ever. But in times of disaster for those patients, we can find them, we can look them up, we can find their prescriptions, we can find their doctors, and we can let their doctors and their families know where they're at. So if somebody, and we are allowed, the governor did allow us to go to North Carolina, which was amazing to me when that happened, that we could go to North Carolina and help them. So that was a really, really great thing. E Plus is evolving. It's kind of a small thing right now, but it's been very, very helpful. We have all but 2 counties, I believe 2 counties, I may be misspeaking, maybe it might be 3, but we have the majority of the counties in the state already enrolled, so they can talk to each other in case of emergency. And the last one was at Milton. Was Milton the last one, Kendra? Which one? Was Milton the last one? The last big hurricane? No, actually. Okay, well, the last big hurricane, I sat at home with my team, with the E+ team, and we called every single shelter asking how many beds, do you have electricity, can you take more patients, what can you do? Like, we are grounds on the feet. We're not just the proverbial state agency. Like, we really care about what we do at AHCA. We really, really care. And I just can't say that enough. I love my job and my position and what we do and how we help people, or trying to help people. We do. So in times of emergency, that's what we do.
And Lauren has a question back here for you, Jamie.
Okay.
Well, first, congratulations on being a survivor.
Thank
you
you
for sharing that with us. One question about, you kind of touched on that you do have contracts with counties, because I'm already thinking about data agreements. So can you talk a little bit about, like, for instance, most of us in here are EMS or fire-based EMS. So can you talk a little bit about, do you have a county currently that has an EMS system on this? And if we have a contract for that county and we're a municipal agency, do we just add an addendum to that, or do we have to do a whole separate MOU, data agreement?
Well, what county are you from?
Palm Beach.
You're already subscribed. All that you'll need to do is, again, grab my card so I can get it to Suzanne, who's in charge of that program, or Kim Davis-Allen, and get you as, what we're running into with E+ is it's this amazing program, but there's 1 or 2 coordinators, and it's not necessarily the people that need to be. I mean, yes, need to be, but you need to have more. And we don't limit how many people have access to it. I was sitting over there just a few hours ago, beta testing the E+ site, making sure it was working, because hurricane season's coming. So all I need is your business card to give to them so they can activate you. And that's it. It's that simple. It's that simple. It's just getting the word out to people, especially like ENS. Like, people don't even know that what we do. I just want to get the word out of the good work that we try to do.
Thank you so much, Jamie. All right, so if you have any other questions for Jamie, we're going to break now for 15 minutes. We're totally on the home stretch. Dr. Willis and I are going to come back and talk about the CMS reimbursements and community health worker training. And Jamie is located over on that side with the exhibitor, so please feel free to give her your business card or ask questions, anything you need to do.
Hit.